So what is painless labor? Many of you have been hearing about many hospitals providing the option of painless labor. So painless labor means something that we give you as an analgesia. So there is analgesia and there is anesthesia. Anesthesia is where we completely numb you down, like for surgeries. But analgesia is where we are reducing the pain. So that's why we don't call it pain-free labor, we call it painless labor. So your pain in labor pains will be brought down by nearly 80%. So this happens most often with epidural analgesia. Epidural is where we give you an injection in the back of your waist, that is in your spine. So, and we give you dose based on your weight and based on how strong your contractions are, based on your pain sensitivity. We'll be giving you a correct dose that will enable you to have 70 to 80% of painless labor pains. So it depends again from person to person. Each individual person has a different kind of pain threshold. Very sensitive women can require more doses, and depending on that we will be adjusting your dose and how you are progressing in labor. It is completely safe to have epidural analgesia in labor, and there are very few contraindications to it. Most 99% of women can have an epidural analgesia. It does not have any side effects for you, it does not have any side effects for your baby. So after your delivery also, when you have finished delivering your baby, so most of you need episiotomy where there are stitches given down below. So those can tend to be a little bit painful for some people, where we numb your area down there. So if you are under epidural analgesia, you will have pain relief even during the closing of those sutures. And also your uterus of this size is shrinking to a smaller size, so that severe crampy pain is felt after your baby is out. So this epidural helps you prevent of that pain also. You will be able to be more comfortable even after labor. So now what happens during labor is you will have severe labor pains. There is tightening of your tummy with severe pain associated with that. So when you take epidural, you will feel the tightness, but you will not feel the pain as much. You will feel maybe about 10 to 20% of the pain, which makes it tolerable for you, and you can give a better chance at having a normal delivery. And you can also walk with your epidural analgesia. It is a myth that you have to be bedridden during labor if you take an epidural. Depending on the dosage given, you can very well walk and you can squat, you can do your birthing ball exercises and all of that even if you have an epidural.